Hello, everyone. Welcome. Good morning. My name is Antonio Corchado. I am the Community Navigator here at the Center for the ONA program. We're very excited to have this morning a great community conversation called Let's Talk About the Vaccine. And with us today, we have Maysay St. Crown, nurse practitioner for MVHS. And we also have Dr. Kent Hall, MVHS Chief Physician Executive. They will be participating with us and explaining and answering questions in regards to any questions that you have or concerns. So we'll go ahead and start with Maysay. Maysay, take it away, and thank you so much for being with us.
Thank you for having me. So just want to introduce myself again. My name is Maysay St. Crown, and I'm a family nurse practitioner. I work for MVHS, and I work at East Utica Medical Office.
Wale kwa demo no awe dini nyai ne no awe pa center ne no pa do ro weda program bu de kama no ke weda let's talk about COVID-19 vaccine no ako ne pakete ko baka do COVID-19 kiti do de agi klo no do tra mi odu ne ke weda Antonio no do awe ke weda let center ne no awe ke weda pon nekle da bu de kama no do ako ne ke ne no pa pot mu weda do tra ken hall do tra mu mesti mo no do tra mu mesti ne no ke ne awe ke weda nurse practitioner le MVHS do awe ma da lo ne ke weda le issue de ka no.
So I would like to say that I want to thank Patty Charvet.
Awe asuk tene edosi blue weda tra mu Patty Charvet mo no.
She's the Senior Vice President for Marketing and Strategy for MVHS.
Le MVHS de kapane tramu gane akeuda we Vice President de kapale bakado we marketing de kapama no.
For inviting me here today to lead the COVID-19 talk.
Do tramu kwemu weda ya le tini nyai kateuda bakado takatu pakete tatepote pote de kai kulono.
And I want to thank Dr. Hall for being with me because I don't think I could do this alone.
Yeah, dosi Lucy Poweda tra Dr. Hall awe he join Poweda le de niña ita te ko kulo no bamu ne ya yi de gane no yete season dane no ye marba.
And I want to thank the center for hosting this event.
Yeah, dosi blue weda center le awe to kurume weda dagita klo kai ni no.
And I want to thank all of you for participating in this event.
Đó ta mata da kai ne no tu he joy ku pa ku mat ko da ko ne no ye do sibu sipo tu ko aden sikol.
So most of you know the COVID-19 has been one of the historic events in our lifetimes.
If the COVID-19 ne ke weda da re do ni de kalepa da umu ke ka sekto sikol no.
It's danger. It's horrible disease that has spread around the world, killing and destroying so many families and communities.
Le hokundo plane no keti da sada kai ne ralosa do lobayo udoma do takadi ba mahawo mati weda pa pagnyotit pado do takadi ba pa to work sikol.
We have been dealing with this virus for over 10 months, and we're not sure how long we are going to have to deal with this.
Da sada kai ne bat de paline oweda ala de sible limono do patete nya ba kasunya ne pagaba umuweda le da sada kai dile ne sector ne patete nya lotilo sediba.
We have lost 500,000 people in the United States alone.
Le pa America ko otopune lono awe pa tatmu hawo kwet hawo kweda ne ke weda the million to wa no.
And the December and January months were very awful for our community.
La January la December ne no ke weda ta awe lota uduma le pa pat wa apu lono.
we saw an increased number of COVID-19, and we saw increased number of death from COVID-19.
Le papat wa pune pati weda wa kanyo le do ni ba weda COVID-19 ne atho takadi ba wa kanyo asatamu lo hawo ku weda anogi di pasi ko ni atho sikolono.
It has exhausted our hospital system as well as our medical staff.
No malo bu weda ba tasahi aklukle di patakadi ba wa le sotwe masa kwatwe di pasi ko ne lo bu weda sikolo.
And especially for the current community, we've lost so many lives.
When lost on that leper, pocket your pot of wabune, but that mu aplane, but how we were done.
So it's very important that we work together. To ensure that we don't go back to those months, the December and January months.
Dito do pag maloti weda le pa deki su dito do la December la January to sikopa.
And that our community is more safer.
Do pa pot wone ka puple ani dia lo.
We hope to have less COVID cases and less hospitalization and death.
Pa mula weda le pwale do ni ba weda ta sai ne ka stralo do pwale ka thoba ta sahi te pani ka stralo do pwatiam lagi ati pani ka stralo.
As most of you know, we've been following the CDC guidelines for the past 10 months.
But then you went as a colon or la pugui a latisi topune pa lupoto da CDC at the neglected pa.
Such as, wearing a mask that cover your mouth and your nose.
No pa kabo da panasi do patakuma no pa toweda takamba pa.
Avoid close contact with people, keeping your 6 feet distance.
That Tomba weda le pakanyo ti pane pa hashe weda do pa ba also to weda wed le pakanyo ti garo ka ambasa ti pa social distance.
Washing your hands at least for 20 seconds with soap and water.
Ti weda na su asraket second kisi mono le klato do ti mono.
And if you don't have water and soap available, you can use hand sanitizer that has 60% alcohol.
When katisu we one tea do klato mido ubane no sapya mido ubane no ba edo hi ba we dale negatu we da hand sanitizer ti pa no wale ma show we da kati ma show su ti pa no do pune ka ba pa we da ti husim lagi ma.
And avoid touching your face when you go out and about because you're not sure when your hands has landed. So make sure that you don't touch your face with your unwashed hands.
Nami uleta kleni no na phoba manule na thoba manule ne patinya no ako ne no nami uleta kleni wita super loss dale na ka ke thoba na meta ne wita super loss no.
And definitely avoid crowds places, poorly ventilated places, mass gathering.
Ako ne hashe weda pa kanyo utalo aga talo de pa no pa kanyo ma super weda aga talo de pa no wita su hashe weda no.
Clean or disinfect frequently touched places.
Dale pato nyonu te patalo te pane wita suma shodo amati tapuka mono.
So lastly, we want to talk about getting a COVID-19 vaccine. That's our main focus for today.
Tani nyai ne no apa tagi mo pa rindo ke tele pete akutone ke weda makado keti dosende COVID-19 taketi semono.
So in order to get back to the time when we knew before the COVID-19, is very important that we get the COVID-19 vaccine.
Dito dapat ke daki su awe COVID-19 to odi ba sekretoni mono awe dito dapat ke daki sekreto akane rindu mane no pa bahini weda COVID-19 keti dot da tasel ni lo.
The vaccines are safe, they are free.
Awe keti dot da keti seti de pai ne where buple dot kadiwa apwekili the Obama no.
They teach your body, your immune system to make antibodies to recognize and kill off the infection in the future.
Well, keti said that the dead pa ito loni weda pa mupwa apu tan dot the dead as hadit pa agidi lene no le kasunya ne awe ka to no weda das ha kai kete do awe ka du weda kete one awe to loni weda.
they don't contain pork or fetal material.
အဝဲလက်အပူနဲ့တပါခုဝဲတာတော့ထောအညာတဲ့နော်မိဝင်းဘာကတော့ဖိုတာအဆယ်တဲ့ပါတဲ့တဲ့ပါနေပါခုစီကောပါနော်
and they are not endorsed by the Pope.
နော်တရခိုင်နေနော်ပွားတဲ့ဟေဝဲတာလဲပွားတဲ့ဟေပွားတဲ့မာဒူထောဝဲတာလဲပစီကောပါနော်
So it's very important that you get the vaccine, and you can get side effects from the vaccine. They're very common.
အခုနေရီဒူကတနေနော်နကဒူနေဝဲတာဒါဆဲကတိဒိုတဲ့တခိုင်လောနော်ဘမ်ဒေါ်တကဒီပါ side effect တလည်းအမဒိုနေကိုတစတဲ့မွေဖို့
Similar to other vaccine that you get, you can have soreness in your arm, you can have fever, chills, you can feel tired, headache.
ဒီတော့ဒါဆဲတာတော့တဲ့ကတိအကအတူစီကောလောနော်အဝဲတမဒူမချီတဆဲဒိုနေနော်ပမစ်ဟဲတာလောနေနော်ကညိုဝဲတာတော့ကစားတော့နကောအဝဲတာတော့တကူထောတဆဲဖို့တော့နကတာဝူကထောနာတော့တကဒီပါကစားနခုဒါခိကစားနကလောဘွီစစ်တာတေဖာနီကိုစီကောလောနော်
Those symptoms usually will last 1 to 2 days at the most.
တာပနောတိတဖိုင်နေနော်ကရီဝဲတာနေအာကတနေတတော့ခိတော်လော
I think that's about it. So I'm just gonna want to share a little bit about my personal experience with COVID.
အခုနေခဏလူပပနေလောမနဘာစနာကင်းရဲ့တော့ဟင်းနော်လောဘာကတော့ရဲ့ဒါလည်းခေါပလို့တစ်ဆက်ဖို့မနော်ဘာကတော့ COVID-19 ခိုင်းနေတယ်အတူစီကတော့အဝဲabandonment.
They tried everything they could not save him, so they had to intubate him.
Awe pa Google se mata pota lo da pa ma te manule ba ko ne pa tron do we da pai ti phalo no.
And they found out that he developed cardiomyopathy from it.
Awe dramo darkane with us in shape akate.
Awe afa hagoma afani. So his heart was only working 10%.
Do le ata da ka pani si ko ne an na do mo do am la ki at si lo ma we da.
My dad have never had any heart issue.
Yapane baka do sta da ka pa ta ko da ket o ba not blow.
So COVID-19 has a lot of complication.
Awe COVID-19 kind of awe tamba tre lo sa do ta ko da ke o do we da.
You know, besides acute respiratory failure, you can develop stroke, you can develop pulmonary embolizing blood clot in your lungs, you can develop kidney failure, heart failure.
Awe tata kaine no nakasada ni ba takarka ba la agasi ko ni ba do weda lo don kelimege non nasamege nakatramu te weda ni le na tui globu awe tui di pane mara le ba megi mo no.
So it was very hard for the family.
Le ba hipokopo wone no ta ko kedu malo.
You know, looking back, I think he could have been alive today if he had gotten the vaccine.
Awe ye ke kwa da ki mo no ba site ye pa ne o mu we ke se di awe medo ni ba we da awe ke ti do de kai ni.
And if we were more careful.
Do awe me ko te ka to ko thelo sa me andin di alone ni mo no.
The sad thing part was that my dad did not go anywhere.
Awe dale allo sa u de khane ye pa ne da ha da lo aga ba.
He was confined in an apartment, minding his own business, but we took the virus to him.
Awe uwe dale hibulo le de bulo masana kene awe peleso we data da ka kaila opum.
Some of our family members were not on the same course, underestimated this virus can do to your body.
Awe ya buti no klani mo no awe te patu pata we da awe das hada kai mumuno no ba do awe te kwasilo we da mo no.
So while you have a chance, it's very important that you get the vaccination so that you can protect yourself, your family, and your community.
Akone pass kwaya dos ako akani mo no pe dole ne ke duni weda awe ta sekti de kai keti dot de kai don na ka dot de weda na ka sada weda kariwana hipo hopo de kariwana parwa mo.
I just want to say that try to be the solution, part of the solution, and not the part of the problem.
Awe edo weda le pakua de ne ke weda tabwasha agi klo taka kir komo no te mi weda le takoda kir kawa mo.
I think that's all from me.
Awe le ye one pone lo.
Thank you.
Thank you for sharing, May. Sorry, I just wanted to tell her thank you for sharing.
No, thank you, and thank you, May. And I'm so sorry about your dad. That's just a terrible loss, and I can only imagine how that's affected you and your family.
Thank you.
Na hosi blusi po weda le tramu mesela awe no lo weda dale koplo do awe tra te weda le tarkani ta losa dumale awe te hipo kopo no.
So I just wanted to mention a few things about the vaccine, and then May and I will answer whatever questions anybody has. Okay?
Awe akene ye ketep ya weda baka do ketindo te der kai agi klo te set te mo po mi wine tati kwa mi one ya tra ho do atramu mesina awe te ka siso da tati kwa ti no.
So first of all, let me say that the way that we're going to get back to normal, the best way and the fastest way is by having as many people as can get the vaccine take the vaccine.
Awe tale le apukui alolo atone pe ke tu weda awone kledbule akli kete do agi kete ne ke weda pa aga ti pane ke doni weda ketindo te dani lo.
And so I would ask everybody who's listening to go out and talk to your friends and your family members to tell them what you learned today, so that they can understand how important this is as well.
Ako ni ye dole pale do na weda na weda da so te pat ninya ine ke kite da kila asako te pa ti ko te pa do awe talen na hu te pa munule ni.
So the first thing that I wanted to say that I know is a concern for a lot of people is the answer to the question, how safe are the vaccines?
Awe tati kwa redo te plane no ke weda ketindo te kai ne apu tele mo.
So I will tell you that they are very safe. That there are minimal or very small amounts of side effects related to the vaccines, and that we monitor people very closely after they get the vaccine to make sure that they don't have any problems.
Awe ye te weda le ketire kai ne apu ple do malo do awe side effect le tabado batini odune weda strakalo do takariba wale do ne we awe keti do te de kai ne no pa kwa weda bubu titi loti lo selo no tamata ko dilema no.
So as May said, the main thing that you would feel after getting the vaccine is some soreness where the vaccine was given in your arm.
Awe ni to tramu mesete to lo no dale awe ta badu te sepone ke weda wase keti alone awe ke nyo te sebudo ke sama no.
And other things that people feel are sometimes aches throughout their body or low fevers.
Wata nodu ne aga ketubale awe amupadoga kesha do awe tanya taku ketot sebo.
Or feeling just tired, and all of these only last usually about 1 day or so.
Awe wata nodu ne ke lobu na no ta no te pai ne aketene ke toweda ta todo to ka kapulo.
Yeah, the vaccines that we're using, you need to get 2 shots, 3 or 4 weeks separated.
kati sedekah do tender kale patuon ni no nakabas hewada kiblo do tablo do basane no ka yiwada ta nuit min matula luinu.
So before these vaccines were approved, then they went through testing on over 30 or 40,000 people.
The klule kati sedekah ni pa ke hiweda akwedi bani no pa awe mal kwa weda suweda le tesi pa kenyo tekla do likla mano pa ma weda mano pa ma.
The reason they were tested on so many people is so we could make sure that they were as safe and worked as well as we possibly could.
Bamnu ko le pa ma kwa suweda le pa kenyo ti paile ni no pe do weda le kati po kai ne ka pu ple weda mano aku ne pa ma kwa suweda le pa kenyo.
So I know one of the questions that I get asked often is, can you get the virus, or can you get sick? Can you get COVID from the vaccine itself?
Awe tati kwa agat plela pa ti kwa ya nyonu ani odune ke wada na mise kati de kai ne ka doni weda awe COVID-19 ya no.
And the answer is no, because the vaccine does not have the live virus in it. It just has a piece of the genetic material so that your body can recognize it and can make defenses against it.
Tati kwa de kai asa ne ne de mi ba no de do ni ba do bam lu ko le ne kati po de kai pu ne no awe ta pho kha le amu ne te pa ba basana ke ne ase put ase to po de khale di to do mi panu la pa mu pa pu ne pa mu pa ka to no we ka ba wo ni lo ka pa we na.
So the vaccine is made from these pieces of the genetic material, and the way that it's made does not use any kind of animals or eggs. It doesn't use pork. It doesn't use any kind of eggs or chicken, because that's how these what are called mRNA viruses are made.
Dito do lekati aga MRA awe pa tuwe atune no but taweti tuwe data pa sapu kopo ase atu mo no genes ne patutuba no ako ne sta kati do se data kai ne patuwe dale makapate tu mo no tekir kholo mo no genes tekir khodi to do pamupa kati nya we.
And even after you get the vaccine, because other people in the community have not had the vaccine yet,
awe na doni weda kati do tada wi basatna ke no lena pot wa pune pot agati phane te doni ba weda wi ba kone no.
Then it's important that you continue to do all the things that May talked about, wearing a mask and washing your hands frequently and keeping social distance from other people.
Ako ne dito do tale pa ma to ne no nakaba ka ba wada na nagba to wada ta ka ba me nagba ti wada na su do nakaba uyilo we do pa kanyo tati de panin nagba sema sikolo man.
Once enough people in our community have gotten the vaccine, then we probably won't have to do these things anymore, and we can return to a more normal way of life.
Wakanyo aga awe me doni weda ta sekati kai tulo zimbali ne no pa ki oda ki dito do apuku eto kesti weda lamana.
So there are currently the virus or the vaccine is being given to people that are at higher risk of having serious problems with COVID.
Akay ne pa arki pa hisu weda kati se kai ne no pa le tabayo weda awo pa awo suma no.
And those people include people that work in healthcare.
Pati de pane pa weda se ko do pa le mara le ta usu klit pa.
People that are what we term essential workers, so people like teachers, firemen, policemen, transit workers, grocery store workers, people who work in the environment and need to keep working for us, for our community.
Awe pa hiwada pa kanyo agadi pat takuluan do ne kewada pa ko wada le essential worker no pa le aluba weda kakimara le ta pita ma puti pa wono ni to do chutra mu de no pa le ma pi me u firefighter de no pa le noka tuli ti pa do pa le sara le kladi puti pa no pa ti pa ne pa hiwada lo no.
It's also being given to people who are older than 65 because they're more likely to have really serious disease should they get infected.
Awe le kita keluar ni pe hiwada pa ta pa ti phale ata ani di khusi ani mono ba mulu ko le ne awe ti ne alo ba yo owe da le awe ti bindo ni weda ta sa ne awe ta sa kan now le awe ti owo mono.
And it's also given to people who have certain medical problems because they also tend to have really bad disease when they get infected.
Wale le apukwine o mawena le tasa de pada noni mono awe mindo ni bani awe te tasana le awe te aputi mono akone pate dipasi kone pe hiwena no.
So some of those conditions that we want to protect the people that have them include cancer.
Pa teklu aklane pa weda le pa le cancer tasadi de pa.
Kidney problems.
Le keli de pa.
Lung problems.
Le patu de pa.
Heart problems.
Le ta de pa.
If they're severely overweight.
Me bod le ne.
If they have diabetes.
Awe tuisa me one.
Or if they have strokes or other problems with their brains or their nervous systems.
Le akonu de pa dasa o ti de pa do ta ka di ba le awe te me pya keli pya pa keli pya po de pa.
So once we've given the vaccine to these people, then the next stage is to give it to basically everybody else, everybody who is healthy and doesn't have these conditions, so we can get everybody vaccinated.
Akene no pa me hiweda kati ser khaile pati pa o miwi ne no lekita petonio ne pagama weda pale o osu klete pa no awe maka patewda dasati pa to o weda pa ganyo ti pa ne pa ki hiweda no.
So I want to encourage, just as May did, I want to encourage everybody who can get a vaccine to get one. I think we'll talk about exactly what the process is for our community, for this community here, in terms of how we can do that. I know that we have what we call vaccination pods that are going to be coming to your neighborhood soon.
Akene no awe pakete weda akene edo hiku weda le pale mithini mono duni weda dase ketiti pa do ta kadiba aklo kle ko odile ne akene pake setep ya do ta yir mo le mane no pa pot work la ne no awe dati pa ne ki hetu lo mono.
So I guess I would ask if anybody has any questions for May or myself or anybody else. That we'll do what we can to answer as many and all questions that you have.
Akene no patati kwa me one no pati ka weda tra mu mesete tra hoti mo no ako ne pag sise weda pet atibe ti mo no.
Thank you, May, and thank you, Dr. Hall. Great information that you've given us. I would like to ask if anyone has any questions to go ahead and unmute yourself and ask.
Sibu matra mu me no tra ho le dagi dak lu ti pa read lu ti pa ko lo mo no do akene pa ko ade tati kwa me one ti kwa ti mo no.
Pastor Debbie, go right ahead.
Hi, thank you all so much for this helpful information. We have several questions. First, what is in the vaccine?
aware tramu devi tikwa wane no aware da tikwa udon dilom no tine no let kati do tede kai apune pa ku do menule no.
So the vaccine contains a small amount of the genetic material of the vaccine, not all of it, just a small amount.
Le kati do tede apune no aware genes the kid kopo pa ku we da lom no kella de me ba the kid ko the segulo no.
It also contains some preservative that is used to keep the genetic material stable until it is injected into people's bodies.
Dito do katile papatu yi we da we maka genes for the color for me cello le pa nyo apune we ko pupe we da woman no da kati ka se ko ne pa we da se ko.
And honestly, that's it. There isn't really anything else within the vaccine.
Ni ba te to ne po ni lo no le da te pa ku we da le kati do da ku lo.
If I may, is in the screening question for a woman I helped to schedule a vaccine earlier in the week, it asked for, is the person taking a blood thinner? Is that a rule out question, or does that just make the people giving the vaccine watch that person more carefully?
Awe tramu de biti kwa we da ne no awe maso da pa nyo daga mo no awe tati kwa taklu le sekati ba ne we ti ba si so da tati kwa phani akla ne no tati kwa o da kha mo no ne akhe ne o we da kati ko le di do ka le na tui o mo no le tin mo no pa ko da ta kha ne ne hi ya mo no do tramu de bi do ti nya da le tati kwa da khai ne bam nu ko ti kwa da le no Koplole awe kwa weda loti lo se kwa kanyo de ai no mi do ni weda kati de kai akone a mi ma ko ne mamu koti kwa na.
So good question.
Tati kwa gi lo.
It is not a rule out question. It is so that the people who are doing the vaccination know that they should look for any bruising that might happen because the person is on an anticoagulant.
Dar kai ne tati kwa kai ne pati kwa ne mamu ko le ne pale se weda kati de kai ne no awe kwa kanyo de gamin do ni mane no pale ma ko tui de pa ta sami o ne mo no awe ke o weda do tanyo ro do awe ta tholu thola de ko mo no ta ti phane pa ko kwa thwe weda loti lo se ko ne pati kwa weda lo.
And lastly, in the screening questions, someone was asked, have you had COVID in the last 14 days, or have you been exposed to COVID? If a person has had COVID, is there a recommended time they should wait to get the vaccine?
Le maga tati kwa le kwa taklu le sekati wa na pati kwa klani mo na tati kwa uda kane no le apu ki tasili to to pu ne le do ni ma weda awe COVID-19 mi wa ko ne na thoba weda le kwa kanyo le weda le COVID-19 no tati kwa kai ne no ba mu puti kwa na le no awe but asegotole kwa kanyo daga ne me o weda COVID-19 ne asegotole akaba o ko weda aklu do ni weda ke ti se de kai ba ne o ya.
So there is no problem with getting the vaccine if you have had COVID recently.
Lolo se mo no na do ni ba wi weda COVID-19 li ne no na me he sekati phone no awe get dile a written do ba mo no.
Because I'm sorry. Because the vaccine has been scarce up until now.
Akane esarole akane no awe ba keti se ne no wita suma se se mo me awe to o ani ba mo no.
Because of that, there has been a recommendation that people who have had COVID can wait up to 90 days before they get the vaccine.
Ako ne pa edo Hiku weda le kwa mido ni we weda lo seline no kwa edo ma uko weda kwisi no atau kwisi awet the clue ke seweda keti no mamnu kulene paketi le ke do tende ni do adi aku.
The reason for the request to wait is really so that people who haven't been sick can get the vaccine first.
Awet mamnu kulene no palet do ni weda ta sadiwane no awete ka do tende weda su do ke do ni weda ta ti ser kai ke su keti owo mono aku ne pa ma uko weda atau kwisi no.
Because if you have had COVID-19, the disease, then your body has developed some natural immunity to it.
When me o we weda keti dasar kai ni no COVID-19 ni no len mu pa pu ne ni to dok ke du ke da ki weda dasar ni no awe len mu pa pu ne awe pa du uro weda ta do te de kali mo no.
Thank you. Abu Pado.
Does anyone else have any questions?
Le pa ga dati kwa udia.
Dr. Hall, I'll ask a question that I'm looking to get answered. What are some of the objections or any myths that you have come across in regards to the vaccine?
Wetra edoti kwa tati kwa mano baka do da seketi de kai ne no awe tra na ku we da di tro pate kolo we da ti pani tra na ku menule.
And the same question goes for May too.
So the probably the biggest one that I've come across and heard over and over again is people being afraid that if they get the vaccine that they'll actually get the disease, and that the side effects that they feel are actually from getting the disease.
Tara kale ye na hunyonu ni mona pa kanyo ti pane lo ba yu we da le aweti mindo ni we da keti se da kai ni aweti kendo ni we da covid da sai mono bam do ta ka di ba ta le kwa se keti do ni we da sai ka se ti pane aweti su mo we da le koplo le he koplo le da sa da kani lo no aweti su mo we da.
And I just want to be very clear, that's not true. That is absolutely not true. You do not get COVID-19 from the vaccine because the vaccine doesn't have the virus in it.
Ako ni ye do te da ne ta ni li te ki de ba no bam nu ko le ne no le ke ti do te da pu ne we pa ta pu kha de pa no COVID-19 a da pu kha de pa ba.
May, what have you heard?
Yes, a lot of current people scared of the vaccines because they don't want to die. They heard that they will die if they get the vaccine.
Na ku da le pa kanyo pu ti pa te wa da mo no awe mid do ni we da ta se ti de kai ni awe te ke ti we da mo no awe te pli we da le ke ti wo.
And there are a lot of myths and that rumors.
Let pat hate ke lo we da le takle ti pani do du si ko lo mo no.
Some people say that it's a way for the government to control the population, to kill off the elderlies.
Awe pa to no suk mu we da le ta kai ni akluk le ka le pa du tu we da le ka pho kha we da pa ka nyo ano gi mo no do ma ti we da we pa ta pa ti pa mo no ma lo sha we da.
They worry that the vaccine will have microchip.
Awe te suk mu we da le ta se ka ti do te de kai ni ka pa ku we da do microchips mo no pa ko we da.
Daniel, you can go right ahead and unmute yourself.
Yes, thank you. My name is Daniel. I'm the Refugee Health Program Director from Mosaic Health, and also I'm part of Utica Current Community, and I work closely with Ms. Maysay. My condolences to you. And yeah, just like Maysay mentioned, like there are a lot of misconceptions regarding about vaccines in the community, particularly many of the Korean refugees are Christians and they're very religious, and they prior to vaccine rollout, there's been huge rumors stating that this is the mark of the devil in a religious way, and so because of those things, like there are mistrust in the community, and we have to be very open and upfront with with the community members that the importance about like having vaccinated. So it's a bit of a challenge and hurdle, from a public health worker standpoint of view. And every time we start talking about it, like they view us as if like we are devil's advocates in a way. So I think one of the important things that we need to educate our we need to bring all the spiritual leaders and give them the informed fact-based information, and some of them, like, they think that like these vaccine included like some part of a human embryo cells, and this goes against their religious belief, and so on. So it's really hard, like I've been helping people schedule for vaccines, and majority of the current folks I reach out to, like majority of them say, like they defer, they don't want a vaccine right now, so it's a bit of a challenge for us.
Say, do you want to try to translate some of that or interpret some of that? Sorry.
Tara mine Daniel mono awe te udane no teklule awe pa kiti dot de haro di bane no ta ke sole pa hate kolone odon dulo mono le aklane sikone pa pa ko nyopu tri pani arkini awe te ke oda pa kripo do awe te tabuta bani sudu malo do pa no sugmu wela ne tara kaine ke oda ta duta ku apono mono aku ne awe pale te oda bakado kiti ser kai mi yene mono awati sugmo weda le par ti pai ne tegi ro tadu da ko mono aku ne awe redu male pa to work aklane pa tep ya weda bakado kiti dot de kai ploplo she dot titi mama mono aku ne redu de kani pa bak we weda pa tabu da bakuna ti pa mono do pa ke bat tep ya weda mono takadi ba la maka trate ne no, tapi not.
Someone dead in Lepuelo.
So I understand where people are coming from being afraid, and the best way that we can talk to them is by being open and honest.
Aku ne dalekle agi dogetene no awe paket tep ya weda patir pa totolu do ploshe mono.
So my understanding is that all of or at least the majority of the religious leaders around the world have endorsed people in their faiths getting vaccinated.
Awe le hokudok le ni mono pati pale bakado ta buta bada kapane awe ti tasuta nani mono awe ti awe ma sudole awe ti nabu ti pa akla mono bakado ketido te kai giklone.
And as I said before, the way that these vaccines are made, they are not made with any fetal tissue or with any animal tissue. They are all made from pieces of the virus itself that are made in labs without the use of those types of tissues.
Do maka petetu ni lo no le ketidot de aklane tepa huwe da do awe puta pu udale muda lo puno asabu ti pani pa ba do takadi ba maka petetu ni lo do pa huwe da tapuka maka takha aki kote se pulo mano do awete ma we dale loti lo sele awete tamalo no le pu hone awe
Great. I see that Lupe raised his hand. Lupe, welcome, and go ahead and unmute yourself and go ahead.
Yes, thank you. I'm sorry I'm joining a little late.
No, you're fine.
Yeah, I just want to add in a little rumor that another rumor that it's been spreading in our community that COVID-19 is a man-made and it is the work of the billionaires who want to make more money and by developing the vaccine. So they thought that they shouldn't like take the vaccine to enrich those billionaires.
ဒါကဆောခါလေပါလေပါပါဟာတေကလောနီမနောဝေဒတခါနေကေဝဒဒါစားခိုင်နေကေဝဒပါကညောတေလောမနောဒေါ်ဒီတော့အဝဲတေကဒူထဝဲဒါကကွဲစီကတိကတိဒိုတေဒီဖာဒေါ်အဝဲတေကဒူနေဝဒစီဒိုဒူအဝမနောအခုနေပေါ်တနောနေနာဝဲဒါလေပတစကရက်စ်ဝဲဒူနေဝဲဒါကတိစေခိုင်ပါဒီတော့ပတဟီဘာဝဒပါတိဖာလေawe aseo te pa no pa ma te pa pa du ro weda ke tipo te pa.
So the best that we know now is that this is a naturally occurring virus.
Da de khale pa te nya lo se ni mo no awe da sar khai ni heke ro da le ni se lo mo no
that existed in animals before it changed to be able to infect humans.
awe sa ro ke ro da le pa sa pu ko pu apu do ma do awe ti so de lo da lo ha ke ro da le pa nyo pu tim.
So I can't there's no evidence that it was manufactured or man-made, so that's all that I can say about that because that's all that we know.
Okay, ne patinya le takhle dune awe tagi taklo loti lo sele awe tapono loti lo sele pa ma da sar khai ne pa nyote ro we da lo ne awe tagi taklo loti lo sele o ba ma ko ne awe yette te on dune da khai ne ke ro we da le ni so ma no.
Excellent. Pastor Debbie, I see you had a question yourself.
Yes, I actually have some shy colleagues here with me today, so I'm sharing some of their questions, but that's okay. I'm willing to be a bridge. So the question is, vaccines are usually developed over many years, but the COVID vaccines were made very quickly. So how can we trust them?
Awe tramune akene akapane owenda do atakole me shamano ati kwa bu ba kune yiti kwa ne wono ba we arkine no das do de ke ti se dir phane kwa du otho weda ne le ani dir phani mo no masana ke ne ke ti se khale COVID-19 awo du ne kwa du otho weda ne le sector ko pulo mo no akune panna oti thele.
So another really good question.
Tati kwale agi de khasi kola.
So we were able to make vaccines against this virus very quickly.
Awe pa du otho weda ta dos tadekati se de khai ne awe le so klilo ti weda lo.
The reason for that was because of how bad the disease is.
Awe tagi de khale pa du otho weda clean no awe bamlu ko le ni tan sar khai anna do ma lo ko lo.
And therefore how much time and scientific knowledge and resources were dedicated to finding vaccines that would keep so many people from dying.
Ako ne no da sector do awe close de pa do awe keti se keti tara de pa le patu ne awe patu do du sikolo.
Each individual vaccine was then tested in a population of 30 to 50,000 people.
Do takadiba awe ketis do tade takai no awe te du otho ne awe te awe makwa suwe dale pa kanyo takla do likla topu mano.
And in those numbers of people there was nobody who had a serious side effect from it.
Do pa kanyo takla do yekla akla ni no pale owen do ne weda side effect tabadum bati do mumu ne to oba.
And since they've been approved and been given to the population, they've been given to millions of people.
Do pa hi weda akwe do pa tu do teli okone no akeni pasaro hi weda le awa nyole akokweli mo.
And there continue to be essentially no serious side effects other than what we've already talked about.
Le pa kanyo akokwe klani se kone no ta le agredo do mumula wete badu batine to odiba do side effect le makapete te pali ni lo akero mo.
And in the United States, the Centers for Disease Control, or CDC,
le pa tiko America tiko bune no le CDC awendane
have set up a system where people who have gotten the vaccine can tell the CDC if they have had any serious problems.
awete maweda aklokle ta kama no system bo ta kale wale do ne wiwe da kapasi kiti ti pat dot kiti dot de pane no di to do awete ta usa odile awete edotem nule ne awete ketep ya weda CDC kete one awete maweda aklokle ta kama.
And through that system, where now millions of people have gotten vaccinated,
koprole aklokle ta ka ko ne no akene pa kanyo aga ne do ne maweda keti se ta kaili.
there continue to be no serious side effects that have required people to be admitted to the hospital or have resulted in people's, serious illness or death.
Awe pe pa kanyo aklane no awe ta kero weda do mumule di to do bak thota sahimeye no ta sa do muhe utone to no gadiba.
Oh, great information all around. Daniel, go ahead.
I have a question to Dr. Hall. Back to the development of vaccines. I'm sorry I couldn't quite catch if I couldn't catch your response earlier. It's the COVID vaccine is based upon the countless years of research like prior. They just piggyback from the previous research from the I believe from the SARS outbreak back in 2003. So they've been developing this vaccine development since then.
Awe tera denya ta ku pada kan no ma ba ka do pa ke tu ro weda kiti dot de ta kai agi klo mo no ma ka tera te na ne awe na ko shishe di mo ako ne do ti pat se po mo no ke weda ne di to do awe pat du to weda da do de kiti de kai ne no pa hi pa se ma ku weda le ta do de kiti de kale ba ka do di to do less has awe ta do kete ta do de kiti ya.
Yeah, so the vaccines that were started to be developed from the SARS outbreak did lay the foundation for these vaccines to be made.
Awe mi weda lo no awe agi koti pa hi weda ni adu ne maka la apu quiz awe sas tas harakane kero weda ni no peni ne pas du ro weda keti dot de kane ne pa hi weda agi koti peni no pa sendu ro weda mi lo no.
And another area that actually helped in the development of these particular mRNA vaccines actually came from developing treatments for cancer.
Di to do keti awe dot de kai ta kai di to I de pai ne pa kedu ro weda ne no he koplu weda agi koti he koplu weda le di to do wa cancer awe ta huti de pa populo no.
So you can see that knowledge from many different areas within medicine came together to help increase the rate at which we could get these vaccines made.
Ako ne awe dito do pagka do ni weda susuklikle di ikete one no lab awe keti da lo do du de pane awe te he papu weda do ma weda ni pachi otilo no.
Great. And I see, yeah, go ahead, Daniel.
Thank you so much for the clarification, because like many people are worried, concerned, because they thought that like COVID vaccines are developed overnight, you know. So thank you for your clarification, Dr. Hall.
Awe siluwe da tra holia da te plau da te pressure te pressure on ni akulo mana. Awe bamnu ko le ne pata no suk mu we da le ke ti do de kai ne du to we da le tni ko na ko apulo.
And I see K-Paul. K-Paul, you have a question?
Tra ko po tati ko.
Me telo wa kanyagla ate teglola. Thank you for this opportunity, and thank you, Dr. Hall and Macy, for clarification, because we have a lot of rumor in our community, especially the rumor from the congregation, the church leaders, and one of the pastor wife, asked me for update information, how many people died in our community here and who are they. And they thought that people were intentionally killed, and they let them die in a hospital, because that one of the reasons is they don't want to have them live and collect the Social Security benefit through in their lives. And we also heard from some high-profile political leaders, when this virus that spread in the United States, that the elder people are ready to die, ready to sacrifice their life to save our country, to keep our economy strong, and to keep the country growing. And I also heard from a pastor who called me and suggested that the vaccine is included the part of the human cell, as Daniel and we mentioned. That is why it looked like they encourage the congregation, the community, not to take the vaccine. And this rumor are being shared, in the community, and these are from this religious leaders. So as we discuss this issue, like if we could, have these religious leaders or personnel from churches to participate and and get the clarification from our professional from the medical field, that it will be very, very grateful opportunity for them, to understand more about how the danger of this disease, and to help them get people vaccinated, so that the country will be able to control this disease. And my question is, I have an adult who was infected and was hospitalized for 3 months in hospital, and later he was sent to nursing home, and he stayed there for 3 more months, and he's now very weak and very tired, and he has to use oxygen all the time. He asked me if he can get this vaccine, because he thought that he might, get more danger for him when his health is still, recover from this disease. So can he take this vaccine while he still recover from this coronavirus disease? Thank you.
Awe tra no bake ta take a lot of pani udo du sikoloma no. Aku ne do pay ne we pa le a lot la udo no te udan do ne no. Awe pa le atapo ati pa no awe ati edo hilo sa le di to do achi ko ti pa ne ke leto da ke sele sunya ke te wona cha ne awe ti na huwe da lo do we ti suk mo weda ne no pa pendone awe du si weda pa le atapo ati pa lo no di to do awe ti edo hi weda awe close le awe ti ba so thwe ma sit da ti pa mi mo no da ti pa ne odon du lo no do ka ba ke ne tra awe ta ti kwa od kha du ne no tako tapa od ga no awe tho weda le da sa yi ko plo le awe du ni weda da sa ra khai ne no oda ta la lui la do akhe ne awe pa le pa da ke le nursing home ne no ta la li do akhe ne a lo bui do ma no do awe ki a klo kle le ake ki ro oda la phamu ni lo ma no awe ta la ki di ba sana ke ne awe do ti nya weda le awe min do ni weda ke ti se ra khai ne no ta ko da ke le o ne o ro ya no ta sa ka na ro yi ma no do ti nya weda.
So the man that you speak of, yes, he certainly can get the vaccine. It would be safe for him to do, and I would say it's also probably would be better for him from his health standpoint as well.
Maka waga nyo daga ni awon ni no ti weda lo no we ka do ni weda ta se ka ti khai ni ka ti weda lo do awe krele ka hi weda lo no ka pu kai lo wo lo.
Thank you, Doc.
Thank you so much for that information. Anyone else have a question? Any comments, concerns that they want to share?
Just one more quick question, or at least comment. Thank you, Dr. Hall and Maysay, for providing this wonderful presentation. And I have heard the many questions about questioning the safety of the vaccine. But I think, we lost Maysay's father, who was a member here at Tabernacle where I serve. We also, as many of you know, lost Pastor Daniel, my Karen colleague. The last conversation I had with him personally, he talked about how contagious this disease was. And I wish he could have lived. He planned to get a vaccine, but he didn't live long enough to do that. I wonder what the current statistic is for the number of people in our county who get COVID and die. It seems to be that chance of dying is much higher than a serious side effect of the vaccine.
Awe tramu edot awe tera sepune no ke weda Siblu weda tra holdo tramu mesi lo do aweti nya psikolog no tramu mesi apa mege no atra atau putra le den nya mege mo no aweti atau utan etinya weda lo to klu tra den nya le pupita wane aloki kita awete weda le tramu da bi khane no te weda no dasar khai ne no lo pri duma do awe ra lo tane kri duma lo ma no do awe basana ke ne tra den nya ne to umu Toto weda di to ka ni weda da sekati de kai man awe ta ulom no do ta ka dwa tramu edot tinya weda le pa county apune no da le nogi no pa le du ni ba weda da sa nogi do pa weda pa le supita nogi de pa no do me tramu what was the last part? I'm sorry.
So in our county right now, what percentage of people who get COVID die?
Le pa county apune no pa ganyo amla kya le aduni weda dasa do le pati pa aklani no amla kya khelle ne watatmu weda ti weda le no.
So the exact percentage of people who get COVID and die is not fully known.
Do loti lo se mlagia loti lo se le wale do ni weda dasa ti pa akla do amlagia loti lo se le pa tatmu hawo weda ni patinya loti lo se ba.
If you include everybody who would get the infection and have minimal to no symptoms and so not need to be admitted to the hospital.
Bamnu ko le ne pe me ke kwa gna kine no what no do ne do ne weda ta sabasana kine at thoma weda ta sahiba no awe at sanita nale puma otis exikolomo no.
The estimates of the people who would die is somewhere in the 1 to 3%. So 1 in 100 to 3 in 100 who get the disease will die.
Ako ne no pa me ke apodom kwasang kwa ne no awe pale aduni ba weda ta sakla ne temle te tuletem lagi ane awe tatmu awo weda ti weda.
If you compare that to the vaccine, where literally millions of people have gotten it and nobody has died from the vaccine.
Do permit ke totro kwa weda le pwa le akwe ti pane duni weda ta sekatili do pwa tendun pwa le tabadu bati side effect le susu ko oronia dune to di ba mono ako ne mi ke totro kwa ne yilo mono.
Then you can see how much safer the vaccine is than the disease itself.
Ako ne nati ba weda ti weda le ta sekati de kai apu pletele lo mono.
I just want to add that so out of 81% who out of 100 81% who got the COVID-19 will just have like mild symptoms, but 19% will develop complication, and I think that according to my research like 5% will probably die from it.
Awe tramu awe huti te nyao du ne no wale dun ba weda ta sa amlaki atakiya aklani no hosi te mlaki ani no aduni ba weda ta sale asrani mo no ta sa pa no asrani o weda hosi te mlaki ya do pale anana weda ni o weda te sikwi mlaki ya do pale te sikwi mlaki aklani ma no pale awe tatmu hawo kwi weda ni o weda yem mlaki.
Well, thank you so much for all that information. We appreciate Dr. Hall and Maysay for being here today. Great information. I think that, does anyone else have any questions before we conclude? If you do so, go ahead and unmute yourself.
Jaku da do po de ni nyai do ta tu kwa ki mi ona ta ku ba pe weda ba ta o ko kai ni ba ni no ta ti kwa mi one awen ti kwa weda ti.
Well, I just have a little comment. It's not really a question. Part of the problem that we can not really educate our community here is that a lot of people who are tested positive do not have any symptom or very mild symptom, and they do not believe this virus is deadly, and it's really hard. Back in December, I think when vaccine became available, Maysay did a very good video for us about this vaccine, and upon our request, and she got back a lot of attack, or even a personal attack, mostly from very religious people, saying that this is the work of the devil or something like that. And we did our best, but I think we need more cooperation from other influential leaders in our community to get involved, so that we can get vaccinated, get more immunity in our community.
Awetra lipudo edote weda se po ordine no ke weda dito do poka he weda ponya le papa kenyo tuwa pune no akodu ba mu ko le ne no arkine kwale do ni ba weda ta sadi phane ta sa pa no ta phla ba do ata sa ta nai ba no wa ti phane aweti ne so mu weda le ta do weda ta sa khai ba no aweti su mu si weda lo no akune pa ti pha aweti ka hi ponya wa do ne na do ma ta kha do ta ka di ba le pamik kwa na ke le la December to pune no sa do awe das he ka ko se ke ti khai sa ro du ro ne no tra mu message ko ne awe du ro weda tep how ro weda le video ta kha pu ma no di to do pa ke weda to ne phe awe te da akhan ne no ri du ma lo ba sa na ke ne no what no do ne he tes how da o sikolono do arkine pwa le tabu tamba tra de kapamo no aweti hete weda da keti se de kaini ke weda baka do tadu traho pamo no ako ne na ne na hei ma weda tade malo no we hete da o jasani sikolono no.
I hope someone will do a commercial for the pod that is happening on Monday.
Awe tramu teu da ne no ten kasinya tenui no le Monday topune no awe tikama weda tagita klo de kamano ako ne edo weda le parga du oto weda libo batinya te sepo no.
Kapale is doing registration for the center. Is that right?
Yes. Yes, sir.
Tra kapolyo ne hiweda kwa selo amisoro no kwa mi da selo ne weda le tra kapolyo.
And we have Corinne translators here registering all day till 3:30 at Tabernacle.
Lepatero puse kone no pale ta kluti weda le pa kino kluti ka sikone uweda sikolono donilo.
And a word of hope, we have 27 Corinne people registered already for Monday.
Akene no pa tinya weda le pa kino po kisinuiga heselo mi we le gaduni weda ketiser kaino.
So we are encouraged.
Ako ne pero hihibamo.
Well, thank you so much for that, for your work, Debbie. Pastor Debbie, it doesn't go unnoticed. Thank you, K-Paul, for also helping out with registration. We are all here at the center helping out with registration so that we can get everyone registered and vaccinated as soon as possible. I want to thank everyone for coming today and being here and participating and asking questions. Dr. Ken Hall, appreciate your help. Mason, we can't thank you enough, obviously in short notice. And again, our condolences go out to you and your family. Thank you so much.
Awe tra edo siblu sipu weda le tra mu tabi dutinya weda kulo do tra kapoli le kwateni weda ta selo misro kunilo do weda sikone pamba weda le center dito do pa ke selo misro sikolo no do edo siblu sipu ba tra ken hole do tra mu mesile hepa ku weda le o teninyai do edo shelo tata ule tramu mese do hipopopo popo do kadwa edo sipu weda papa kenyoku adele hepa ku weda do pa tarita ketinginya lo no tablo.
And also I want to thank Lupe and I want to thank Daniel Kriv also for being here and being valued partners to the center and the ONA program. We can, I can't begin to tell you how much we appreciate your help, for trying to get people to this community conversation.
We edo si blue weda tra lupendo do tra Daniele hepa ku weda teninyai do tekadwa tikwa weda tikwa tipa kulo no.
So with that, we'd like to conclude. If there is no other comments or questions, this was being obviously recorded. We are looking to post this and make sure that everyone can see it. I think it's excellent information and that everybody needs to hear what everyone had to say and shared. So thanks again. I will ask if May and Say can stay behind for just one more second after we conclude. Everyone have a great afternoon. This was a great community conversation, our ONA program here at the center. And if you guys want to reach out to me, my email is antonioc@thecenterutica.org if you have any questions or concerns on anything. So thanks again. Have a great afternoon. Take care.